I'm Michelle. I've been a massage therapist for 20 years. I specialize in recovery massage. I work on anything from injuries to chronic pains that we have on an everyday basis. Now, I'm seeing two problems repetitively over and over. This occurs in our shoulders as well as our pelvis. In this video, I'm going to focus on the pelvis. What I'm seeing is what is called an anterior pelvic tilt. This drops our pelvis down in the front because our quads are overly tight, and this is also causing our hamstrings to become overly stretched and lets the pelvis lift in the back. Now this can cause all kinds of trouble as far as lower back pain, hip pain, knee pain, ankle pain, foot pain. It's endless. Anything lower extremity. So really, what we want to do to fix this misalignment is to stretch out our quads and strengthen our hamstrings. So we really want to be here in a nice straight line in the front, not here. So I'm going to begin by showing you a 4-step kickback routine. You're going to get on all fours on the ground. You're going to place your knees under your hips. You're going to place your hands under your shoulders. You might not get it perfect, that's fine, but just try to get close. Then you want to remember to keep your head in line with your spine, and you also want to engage your core a little bit so that you're keeping your stomach flexed, and this will help protect your lower back during this routine. You don't want to be drooped. You don't want to be curved. Now, with this, you're going to have a tendency to want to rotate the hip open to the side that you're lifting your leg on. So just make sure you're always keeping your hips square with the ground when you're doing this. So, kickback number 1, you're going to want to push your heel back. You can see I'm just going to be pushing that motion through the heel. 1, 2, 3. Then, for the next one, we're going to point our toe and lift up. 1, 2, 3. Following that, we're going to simply bend the whole leg up, 90 degree in the knee. And then for the last one, from this position, you're simply going to do a hamstring curl, pulling that back. And you can do these 5 times on each side, 10 times, 15, 30, whatever you feel. Of course, you're going to want to do it in both legs. Now, after you finish this routine, you'll really probably want to just stretch out your lower back quickly in your glutes because it'll get you. So just stay there for a couple of minutes. Now, if you cannot get onto the floor, it's great to do this exercise on a wall. I'll use this lovely arch chair for right now. And really you just want to hold the wall if you have that, but I'm going to hold here. And press your pelvis forward, engaging those glutes. And you always want to make sure your glutes are engaging, whether you're on the floor or up here. And hips square with the wall. Now we're going to do a straight kick back here. We're going to do the same bent leg, kick back. And then we can do the curl like we did before. So play around with it. If you have a chair or something that you can hold on to for balance too, that works as well. So that's our strengthening portion. Now we're going to also go into a stretch for the front of our body. Anything that brings you into a backward C is great, but this is a super simple way to start. Toes out, tops of the feet against the mat, hands at your chest. Now, when you begin this, keep your hands weightless and just lift your head up slightly in your chest, actually. You want to lift from your chest. And you'll already feel the glutes engage and the quads stretch. Now, as you feel comfortable with that, just slowly push yourself up from the chest. Now when you add your neck and chin and pull your head back into that, you'll get even more stretch. And then you can go a little bit further. Just do what's comfortable for you. Now, with this work I'm giving you, if you ever feel sharp pain or pinching, please back off and see your doctor. This stuff I'm showing you is for preventative care for, aches and pains, not for a sharp pinching pain. At that point, you probably need some professional care from your doctor. So please take that step if necessary. So last but not least, I want to show you our foam rolling technique for this. So we're going to lay this on the mat, and we're going to put this underneath the middle of our quads at first. So we're just going to come down to the floor. The middle of the quads are going to be a lot less sensitive than the attachment points. So just want to get comfortable loosening those up. You can see I've got my arms flat on the ground in front of me. This gives me a ton of stability. Now, as this part feels comfortable, move to the top of the leg, where it's going to be a little bit more extreme. And then you can move towards the knee, where it's going to be a little bit more extreme. You can do long lengths, ironing it all out, or you can do short little lengths, and you can even just do static pressure, because at the beginning, this is going to be really intense, so that might be all you can take is hold it in one spot, move, hold it in another spot. You can be on your computer or reading your book while you're doing this, whatever. Now, when you feel like you've mastered these things I've shown you, you can also play around with rotating the feet inward and outward while you're rolling. So like you would put this toes out, do a roll or two or whatever. Put them middle, and then turn toes in. And that will get different aspects and variation of that muscle rolled out. So that's it for our beginning sessions, to just give you some tips and tricks for how to help resolve that pelvic tilt a little bit. Now, please, if you have any questions, comments, post them to me and I'll try to do what I can to help you out. And otherwise, I just hope you take care and God bless you in your recovery.